continue, we move. So the next one is what if the colonoscopy shows negative something abnormal? Okay, so if it does show something abnormal, then they will do the biopsy. Then they take a portion of your colon, a sample of the colon lining out, and then they take it to the lab for further evaluation to check your risk for cancerous cell for analysis. Biopsies are used to identify many conditions, and your doctor might order one even if he or she doesn't support cancer. Yeah, it doesn't suspect cancer. If colonoscopy is being performed to identify sites of bleeding, your doctor might control the bleeding through the colonoscope. How do you call it, guys? By injecting medications or by coagulation, sealing off bleeding. You understand? Let's say you're having GI bleed. They are saying that your doctor will seal the site of the blood. You know how if you are at risk of bleeding, they can give you potassium and vitamin K to block your risk of bleeding, something like that. So I guess they have things they use to block the site, kind of seal the site and prevent it from bleeding. So absolutely, now we know that it's not just done, colonoscopy is not just done to check your risk for cancerous cells, but also for other things, including why you are bleeding. Okay. Yep. Okay. Your doctor might also find polyps. We talk about that during the colonoscopy, and he or she will most likely remove them from the examination or during the examination. These procedures don't usually cause any pain. That's what they say. They said removal of the polyps don't cause any pain. What are polyps and why are they removed? Polyps are abnormal growth in the colon or in the colon lining that are usually benign. So when you say something is benign, it means it doesn't have a risk of causing cancer. Okay. Non-cancerous, yeah. They vary in size from a tiny dot to several inches. Your doctor can't always tell a benign polyp from a malignant polyp by its outer appearance. So he or she might send removed polyps for analysis. So apparently, when they get the doctor, you know how you can see skin rash and see it's red is this. Apparently, when the GI doctor sees a polyp, they cannot just see, oh, it's big, it's small, it's black, it's this. So it means that you are definitely at risk of cancer or it is a cancerous cell. No, they can't just do that by their eye. So that's why they will take a portion to the lab for analysis. I am thinking that regardless of whether you have a risk of cancer or not, once they are going in, I think that is the purpose of it. They will still do biopsy. They will still take a cell out to do biopsy. So I will ask that and I'll update you guys when I go. Hi, Philip. How are you? Hola. You see, I think that is the best thing to do. So I will ask, would they do biopsy? Because when I did my dermoid removal, cyst removal, they did biopsy, but because it's dermoid, it's a cyst, so they want to make sure it doesn't have any risk. And yes, I didn't have a risk. So I'll find out if he will. First of all, we're talking about polyps. All right. First of all, we're talking about polyps, and then we're also talking about tissue, like GI, the colon tissue removal. So they will take a piece of the colon tissue, that is the biopsy, and send it for analysis. And they will also remove the polyps, if any, and also send it to the lab for analysis to determine if you have any risk of colorectal cancer. So he didn't discuss any of this with me, okay? That's what I'm saying. All this is new to me. That's why I'm taking my time to read this, and I'm reading all this with you guys. Okay, so we're gonna be here for a while, and because I talk a lot whilst explaining, yeah, we're gonna be here for a while. It's pages upon pages, but I choose to do this today, and it's important to review these documents early. Why? So that if you have any question, you write them down. What do you mean by Obama? Don't do that. Don't put anything political here. It's Moari week. Elsa plant. Okay. You see what I'm saying? So that's one thing I'm going to ask my doctor, my GI doctor, when I go. Would there be a biopsy done? Yes. And then, of course, after the procedure, he will tell me if there was polyps or there were not. I will find out, did they send any to the lab for analysis? Because I feel like that, thinking of my demoisis, I think that is the basic thing that will be done ethically. You get it? Why no politics? Really? What do you mean? My page is not for politics. I don't know anything about politics, so it's ideal for me not to discuss politics here. Politics, no. Okay? However, I'm a believer of God, so I do talk about God. It's my faith. And it's okay, whatever your faith is. I'm not judging you, so don't judge me too. Does that make sense? Yeah. What are polyps? So we talk about that. Polyps can be benign or cancerous. And when they are benign, you cannot know by just your eyes that they are or they are not. We already read that. So that's why they send it to the lab for analysis. Okay, because cancer begins in polyps, removing them is an important means of preventing colorectal cancer. Oh, I see. So we know where they generate. They start from the polyps. So it's important that when they see the polyp, they remove them. Just as important as it is also to take the polyps to the lab for analysis to determine anything else. Yeah. How are polyps removed? Do we need that? Your doctor might destroy tiny polyps by fulguration, that is burning. Fulguration is burning, or by removing them with wire loops called snares, or with biopsy instruments. Your doctor might use a technique called snare polypectomy. How they do the colonoscopy, the ostomy. You know how you have ostomy bags, right? And then you know how you have mastectomy, removal of tissues, right? Breast tissues, what's the name? Your uterus. Anytime you see ectomy, ostomy, tummy, it means, and this is for nursing students, okay? So that you know what these things are whenever you see it. In nursing school, that's how they taught us, and then itis. Itis is always known as infection. So if you are new to nursing, those are some of the first things they teach you so that it sticks with you for a lifetime, because you're going to need them you want to know, not to be mean, but you want to know, where do people go when they die? Oh, I am a believer of staying right here on earth. I just get buried. Yes, that's my faith. That's what I believe in, okay? I don't believe that somebody die and go to fire or go to this. All right? So don't come and be setting me up here. All right? You want to know? Good for you. This is not a page for that. This is a page for, you can ask any mind questions, medications related to the mind and stuff, but not religion or political questions should be asked. Okay? Thank you for understanding. Thanks for being here, by the way. Tona Chinobi, how are you? How are polyps removed? So now you know, by bending. Fulguration is bending them. If they are small, they just bend them away, or they use wire to kind of scoop them and twist it and remove it. The same procedure is used the same way. This, I think, in the demosis remover, the same. They use the thing like and they kind of cut it out, and it's like a net, and they fetch it away and bring it out of your over tubes, your fallopian tubes. If you are not careful in the procedure, you will lose your fallopian tubes. Thank goodness I didn't lose mine. Both of them were preserved. My ovaries were preserved, so that's a good thing. In case I want to have a pension baby. So yeah. Being silly. Yeah, but you need the ovaries and you need the tubes to have a baby. So even though with themselves you still have risk, how much more you don't have them. So take note. That technique involves passing the wire loop through the colonoscope and removing the polyp from the intestinal wall using an electrical current. You should feel no pain during the polypectomy. What? Polypectomy. Polyp removal is polypectomy. What happens after a colonoscopy? So now we know what's going to happen during. What colonoscopy is? Colonoscopy is what it involves and the things you need to know about the procedure. Now, what happens after the procedure? You will go home after you are awake enough, meaning you are awake from the anesthesia that was used or the sedative material or chemical that was used. Your physician will explain the results of the examination to you, although biopsy results will be available 1 week later. So they will still do the biopsy regardless, which is a good thing because that should be a whole package. That's how I see it. That should be a whole package. That's the purpose why they are doing this anyway, to find out your risk for colon cancer. So why would they do the colonoscopy without doing the biopsy? So you must arrange for someone to drive you home and stay with you. That is what they expect. They expect someone who is 18 years or more to stay with you for at least 24 hours overnight after the day of your procedure. You might have some cramping or bloating because of the air introduced into the colon during the examination. This should disappear quickly when you pass gas. You should be able to eat after the examination, but your doctor might restrict your diet and activities, especially after polynectomy. So if they remove polyps, then that can also affect your recovery instructions. Okay. Anyway, YouTube, we are at another 13 minutes, going on 14. So I'll end this one at 15 so that we can start the medication the prep. What are the possible complications of colonoscopy? I think bleeding will be number one. Colonoscopy and polynectomy are generally safe when performed by doctors who have been specially trained and are experienced in these procedures. Yeah, that's why I'm very confident in my doctor. One possible complication is a perforation or tear through the bowel wall that could require surgery. Wow. So if there's a tear of your colon, then you're gonna need a surgery to put it together. Thank God it's not gonna be our story. How about that? Our story will not be that. Okay. Definitely bleeding. Bleeding might occur at the site of polyps, polynectomy or biopsy, but it's usually minor. Okay. Bleeding can stop on its own or by controlled or be controlled through the colonoscope. I need to put it in and find the pronunciation because this is too complicated in my mouth to sound. It sounds terrible. It occasionally requires follow-up emergency treatment. Wow. Some patients might have a reaction to the sedative or complications from heart and lung disease. Whew, that sounds overwhelming, but God got us. We're going to be fine. We are in fact fine already in Jesus' name. Although complications after colonoscopy are uncommon, it's important to recognize early signs of possible complications. Contact your doctor if you notice severe abdominal pain, fever, or chills, or rectal bleeding, or more than 1/2 cup. So you're bleeding, and the bleeding is more than 1/2 of a cup. Note that bleeding can occur several days after the polypectomy, the polyp removal. After the polyp removal, they said it can take after several days for you to even see bleeding. So you may not bleed right away, but you can bleed eventually. Okay, what to eat? So this is preparation. So we're gonna end the YouTube video again and start another one. So I guess I'm gonna change the title of this one and make it the risk factors or complications, possible complications after colonoscopy. That's what I'm gonna title this one. And then the next one I will title it what to do before, what to eat and what to avoid before the procedure. That's what the next video is going to be. So stay tuned. YouTube, we're going to start another one again.